Hey guys, Dr. Bodle here, and today I wanted to do a bit more of a focus strategy video on omega-3 fatty acids and how I use them in my practice. I've mentioned before that whenever I'm assessing a patient's situation, I always want to make decisions or recommend changes that have a magnified outcome for whatever change we're making. And when it comes to supplements, we want to choose things that are going to check multiple boxes for that patient when it comes to their physiology and the symptoms that they're experiencing. There are so many supplements out there that could be good for us, but are they good for you? And can they have that magnified effect that allows you to start feeling better? When it comes to omega-3 fatty acids, I think they can make a lot of sense, and they tend to fit in with a lot of the areas that people with hypothyroidism tend to struggle with. Omega-3 fatty acids are anti-inflammatory, they can help with blood sugar regulation, they might improve outcomes when it comes to cardiovascular health and blood flow, and they're a necessary precursor to the building of our sex hormones and our overall hormonal health. And while there are people and publications out there who think omega-3s are a bit of a farce, I tend to disagree. Some of the papers used to dispute the usage of omega-3 use healthy populations, and when they add omega-3s to their dietary regimen, they don't see much improvement or change. However, there are a number of papers out there that show people who are already in a disease state taking omega-3s and seeing benefits. And we know that people with hypothyroidism are not comparable to the general population and, as you're well aware, struggle with a number of different symptoms. Additionally, I do like to look at historical trends, not necessarily for the ultimate and definitive proof of what we should be doing with our health, but I do think it can help to inform our decisions. And something that I find really interesting and compelling is this estimated change that we see in the ratio of omega-6 to omega-3s within the human body as we've added a more industrialized and processed diet. Multiple sources suggest that human beings should have a ratio of omega-6 to omega-3 of either 2 to 1 or even 1 to 1. And that's a far cry from the averages that we see in modern society, where most people have an either 15 to 1 or 16 to 1 omega-6 to omega-3 ratio. In fact, I've read some articles that have mentioned even higher ratios of omega-6 to omega-3, meaning a greater discrepancy between the two, but I haven't been able to always verify those sources in the literature, so we'll just stick with the 15 or 16 to 1 right now because that seems crazy enough for me. But the reason why there's such an imbalance here is because the more processed modern diet is high in omega-6 fatty acids and it's deficient in omega-3 fatty acids. And whenever we see these trends that are very short-lived when compared to the history of humanity, but might coincide with some of the onset of many of the chronic conditions that we're struggling with, I think it's something that we should at least take note of and then decide, is this something that we can leverage for the betterment of our patients? And while more research definitely needs to be done, some of the early returns from preliminary studies have shown some favorable outcomes. For example, the lower a woman's ratio of omega-6 to omega-3, the lower her risk of breast cancer. If a patient with rheumatoid arthritis can get under a ratio of 3 to 1, then they have a decreased risk of inflammatory symptoms. And for patients with asthma, if their ratio was under 5 to 1, then they had improved outcomes. But if their ratio was above 10 to 1, they had adverse responses. Now you might have noticed that when I was listing those studies, I didn't mention any improvements in thyroid symptoms. And that's because there isn't a lot of research to point to. But when our research is limited, this is when I think it's so important for us to understand mechanisms. Sure, there isn't an exact paper that tells us how much omega-3 fatty acids we should be taking if we have hypothyroidism. But we can look at some of this other testing and say, which of these situations is similar and how can we apply that to something that makes sense to us? So although breast cancer, rheumatoid arthritis, and asthma can sound very different than hypothyroidism, the management of those situations does have some similarities. And it comes down to reducing inflammation, supporting better immune health, and making sure that we have the proper building blocks on a cellular level. But if we think that omega-3s might be a good option for you, how should we actually implement the strategy? Now, I know a lot of people out there have concerns over the freshness of omega-3 products, and there's also concerns around the potential contamination with heavy metals. Now, I do think that both of these are totally valid, but I also think that it applies to any supplement or any nutritional approach that we're taking. Quality, especially when we're dealing with hypothyroidism, is important, and we should always try to do our best. However, just because some supplement companies take advantage of the situation and don't produce a high quality product doesn't mean that all of them do. And as always, I would recommend that you do your due diligence, research the brand, read some reviews, and if possible, I like to use companies that do external third-party testing to verify that what they say is in their product is actually in their product and it isn't contaminated with anything that we don't want in there. The other thing that we want to make sure that we're being nice and tidy with is that we're dosing with the right amount of omega-3. So something that you might see some companies do is they'll put 500 milligrams or 1 gram of fish oil on the front of their bottle. But the key thing there is it says fish oil. It doesn't say omega-3. And if we're really looking for that anti-inflammatory impact, if we're looking to balance our omega-6 and omega-3 ratio, then we don't want to get tripped up by some sly marketing. What you should do with any nutrition product or supplement is ignore the front and immediately flip it over to the back and look at the nutrition label. What you'll find there is the source of your fats listed and how much is in each serving size. Underneath that will be a breakdown of our main 3 omega-3 fatty acids, including EPA, DHA, and ALA, and it should tell you how much of each is in the product, or how much of each makes up that total amount that's listed. For example, in some of the cheaper products, it might say fish oil, 1 gram per serving, and you're thinking, oh, that sounds like a good amount. But when we look at the actual breakdown, you might only be getting 200 or 300 milligrams of that gram coming from omega-3s. The others could be omega-6s, omega-9s, or other fat compounds that really aren't going to deliver the same therapeutic outcome that you're looking to achieve. So the closer you can get the total amount of omega-3s to the total amount of fat or oil in the product, the better off you're going to be. In fact, some of the better products out there won't even list that deceptive first number. They'll just say, here's the total amount of omega-3s in this product. And again, that's really the only number that we care about in this situation. But the other issue we need to be aware of is even sometimes in products that are mostly omega-3, the actual dosage of those omega-3 fatty acids isn't enough for us to be clinically effective. A decent chunk of the research agrees on the fact that you should be taking at least a gram per day, which is why I think a lot of products center around 500 milligrams or 1 gram as their serving size. So you can see why if a product has pure omega-3s, but it's only 100 milligrams, that could be a problem for you getting up to the actual dosage that's going to be effective. However, there are research papers that suggest that higher doses can be better for us. And I'm always looking to elicit the maximum amount of change for my patients as quickly as we can. Over the years, taking into account both the research and what I see clinically, I've settled on using a window of about 2 grams to 6 grams depending on the individual and depending on what we're trying to achieve. I'll usually start someone for about 3 days with 1 or 2 grams per day just to check tolerance, but the more inflamed someone is, the more likely I'm going to be to recommend a higher amount. Now, of course, you got to remember one of my big rules when it comes to supplements, which is we don't want to just take supplements to take them. We want them to actually be effective for us and elicit some sort of change. So if I do have a patient who's showing signs of inflammation and we're wanting to improve that situation, then we're looking for symptoms that are associated with that inflammation to improve for us. Common metrics might include things like a decrease in joint pain, a decrease in brain fog, an improvement in skin health, or a reduction in PMS or menstrual symptoms. But keep in mind, just like when we talk about nutrition, just because 2 people have the same diagnosis doesn't mean they're going to respond equally well to the same nutritional strategies, and the same goes for supplementation. So although I like omega-3 fatty acids, I think the research is solid, and I find it to be an effective tool in my practice, doesn't mean that it's going to be perfect for you. So what your job is to watch this video, look at the evidence, look at your health history, and make a determination of whether or not it's worth a shot. If it makes sense, implement those changes while minimizing other variables, and keep track of your symptoms. If you can't look back over a 30 or 60-day time period and see some noticeable improvement, then omega-3s might not be fitting that need for you, and you can look at other options. But as I said at the beginning of the video, this is something that I frequently do with patients, and I'm always looking to pass along little strategies or tips that you can implement easily in your own life. I hope you liked the video, and if you have any questions, leave me a comment below, and be sure to let me know if omega-3 fatty acids are something that you're using and something that you found to be effective. If you enjoyed the information but know that you need more help and you like my approach and would be interested in working with me one-on-one, then you can start that process by sending an email to contact@seattlethyroidhelp.com, and my staff will help you to set up a free consultation with me. I got a question on a video from a year ago about whether or not I'm still doing consultations, and the answer is yes, I'm still in practice, I'm still trying to help people, and that's also why you need to subscribe to the channel. That way you'd see my new videos and you know that this is still the case. Of course, if you'd rather do some things on your own, I have options for you as well. You can grab either one of my free downloads listed in the description box, or you can check out any of the other videos on the channel. But that is a wrap for this week. I love and care about you guys. I hope that you're doing well, making changes, seeing improvements in your health, and you're able to engage in your life in the way that you want to. If you haven't done so, it's always a big help if you could give this video a thumbs up, subscribe to the channel, and also ring the bell. I post videos every Thursday, and that'll let you know when they're available. But my name is Dr. Bodle. I hope you guys have a great rest of your week, and I will see you in the next one.